Hey guys, I'm Ceazar from SNU Therapy. Today we're going to be talking about headaches. Now there's many forms of headaches, including cluster headaches, that time of the month headache, your significant other headaches, but the headaches that we're going to be talking about today are caused by trigger points, or what a lot of people call knots in their necks. Now, how do we develop these knots? These knots are developed by muscles going through trauma or muscle going through repetitive strain injury. So a healthy muscle fiber looks like this. When a muscle goes through an injury or goes through repetitive strain injury, they actually separate like this. Okay, now when the muscle starts to heal itself, the muscle contracts, and then when it reattaches, sometimes it doesn't always attach the way that we want it to. Sometimes they start detaching like this. Now these knots cause limited range of motion, they cause chronic muscle tension, and they also cause headaches. Patients who experience headaches right in this region and through here, those headaches are typically coming from a muscle that we call your trapezius, which is located right in through here. Patients who are experiencing headaches right on the top of their head, right in through here, are coming from a muscle called your sternocleidomastoid, or your SCM, which is located right in through here. Now, headaches that are located behind the eyes are from a muscle that we call your suboccipitals, which are located right in through here. Muscles or headaches that are located at the top of your head typically come from a muscle called your splenius capitis, which is located right in through here. And headaches that you feel right in the back of the head, right in through here, is coming from a muscle that we call levator scapula, which is located right in through here. Now, to know that we're on the proper trigger point, we activate these trigger points by pressing on them, and then they usually follow that referral pattern that that patient is feeling. So we recreate that symptom that patient's feeling to know that that's where their headache is coming from. We're gonna do a trigger point release for the trapezius muscle. Okay, so remember what I said earlier, the trap pain refers from back here, and it kind of makes that question mark pattern, and it kind of ends up right in through here. Now, it doesn't have to follow that specific pattern, but typically if we activate a trigger point on a patient, it'll tend to follow that referral pattern. So that's how we know that's where she's getting her headache from, okay? So I'm not gonna go right in there and dig into that trigger point because she's not gonna be very happy with me, all right? So what we do is we do a little bit of warm up. So we compress the trap. We're gonna do some light fascial work. So all these techniques that we're doing, it makes it easier to get to that trigger point. If she's super tense, my fingers aren't gonna get in there. So again, we're just loosening up the fascial lines in her neck and loosening up that trapezius muscle. And after we got that muscle nice and warm, now we can get into something that we call a muscle strip. So the muscle strip is kind of like, it's a great way to kind of straighten out the muscles and stuff like that too, but I also use it to palpate for trigger points. Once I find a trigger point in her trap muscle, what we do is something that we call an ischemic compression. We just press down on that trigger point. Now that trigger point, we know that we're in the right area because you got to maintain contact with your patient. So I'll ask her, where is it referring to? So where's it referring to?
On the side of my head.
Side of her head, okay. So at least we know we're in the right area. So typically, when we're trying to release the trigger point, we hang out there until her pain scale is about a 3 out of 10 or until it numbs down completely. Once it numbs down completely, typically I would move maybe a finger breadth right beside that trigger point, just because she'll probably have another one right beside it. If we tend to kind of move so quickly along her trapezius muscle, we may miss some trigger points. So if I find one right here, I'm literally moving right here. You'll generally find them 2 or 3 in a row. Now that she's relaxed and the trigger point's relaxed, we continue to strip out that trigger point. We get into muscle release techniques to help lengthen that muscle. So we take it from the shortest position and we lengthen it all the way out. You okay? Mm-hmm. And we give her about 8 to 10 passes, at least until we feel the muscle's about to relax. After that, we do a stretch for her trap to help straighten those muscle fibers even more. And I always finish off with a little bit of traction. So what I'm doing is I'm palpating for the base of her skull, and I'm distracting her head towards me. Just because a lot of that muscle tension tends to bring her neck downwards a little more, compressing a lot of the disc here. So we like to distract the neck, and that's how we treat a trigger point in the trap. If you are experiencing any of these headaches, don't be so quick to jump and take a Tylenol or an Advil. We're just building a wall over the actual issue. We're not doing anything about the issue itself. Again, if you're experiencing any of these symptoms, please consult a physician or you consult any one of us here at Strength U Therapy. Again, my name is Ceazar. Have a great day.